Hi, beautiful people. How are ya? I hope you're having a great day. Although most of us know that growth hormones relate to height of a person, growth hormones do so much more. They're responsible for repairing and restoring damage to our muscles and tissues caused by living our lives. We need growth hormones to produce proteins that will repair tiny muscle tears called microtraumas. It also replaces worn out tissues. So if we don't have enough growth hormone, repairs to our muscles and tissues doesn't happen, and we get pain. Also, our hypothalamus in our brain will release growth hormones when the pituitary gland prompts it to. Our pituitary gland stores growth hormones, but once this important hormone is in the bloodstream, the liver is stimulated to release insulin-like growth factor 1, which is also called this. It's a hormone in the same family as insulin. It is IFG-1's job to tell the body to repair and restore muscles and tissues. It promotes growth and development of bone and tissue. These hormones affect how our body metabolizes sugar or glucose. So along with insulin, works to rapidly reduce the level of glucose in our blood. It's said that growth hormone deficiency and fibro share many common symptoms, including fatigue, weight gain, cognitive dysfunction, and mood alterations. In addition, low energy, muscle weakness, cold intolerance, and a reduced capacity to exercise are also found in fibromyalgia and growth hormone deficiency in adults. Adult growth hormone deficiency is rare and is often not tested, and treatment with growth hormone is expensive, and most insurances will not cover it because it's considered off-label. About 80% of growth hormone is thought to be released while we're in our deep sleep, which is obviously shown to be disrupted in fibromyalgia. Another theory involves the hormone somatostatin, but it inhibits the release of growth hormone. The hypothalamus can stimulate or inhibit growth hormone signals. IGF-1 used to be known as somatomedin. Since it acts a lot like insulin, low levels of IGF-1 have been associated with diabetes in research studies for people under age 65 without cardiovascular disease, and serum cholesterol, lifestyle, and body mass index were adjusted. So in type 1 diabetes, low levels of IGF-1 may be linked to the increased secretion of growth hormones. Growth hormone concentrations are 2 to 3 times higher than in people without diabetes. And it's believed that abnormal levels of growth hormones may play a role in the complications associated with diabetes. But higher levels of IGF-1, insulin resistance, and inflammatory markers have been associated with cancer risk, type 2 diabetes, and obesity. Fibromyalgia, generally what's seen is just low growth hormone levels. But additionally, your doctor may check for low thyroid hormone levels or hypothyroidism, liver disease, and diabetes that isn't controlled. Sometimes an irregular blood test may mean that there's nothing wrong, so your doctor may have a reasonable explanation. Treatment might include this: an artificial version of IFG. It's a prescription medicine, but it can cause low blood sugar. Complicated, and more research is needed. And dietary supplements that say they contain IGF may not even contain IGF and could potentially contain harmful substances. About 41% of the U.S. population has lower than normal vitamin D levels. But researchers in 2020 stated that people with prediabetes who were supplemented with greater than 1,000 IU or units per day of vitamin D may significantly reduce their risk of progressing to a diagnosis of type 2 diabetes. So I check the amount that I take, and I take exactly 1,000 units of vitamin D3 a day. So I've recently started taking a little bit more. And D3 is better for raising blood levels of vitamin D. For most people, the upper limit is as high as 4,000 units. But I've linked an article that states how much individuals can take based on needs. But you should always talk to your doctor. There is an association between low vitamin D levels and impaired insulin secretion and increased insulin resistance. A short-term experimental study in 2011 showed supplementation of vitamin D and calcium and adults at risk of type 2 diabetes improved pancreatic B cell function and had a marginal effect on lowering HbA1c. And in case you missed my video on being diagnosed with prediabetes again, I'm on a quest to get it figured out why this has happened. Obviously, not eating sugary foods isn't enough. There are loads of research articles on the topic of hypothalamic pituitary growth hormone insulin-like factor 1 axis and its perturbations in fibromyalgia. In a 1992 study, researchers Bennett, Clark, and Burkhart found in 70 female fibromyalgia patients compared to 55 healthy controls significantly lower levels of IGF-1. This was big news and showed there were real physical signs that fibromyalgia had a plausible neuroendocrine pathology. However, this wasn't found with chronic fatigue, what we call ME/CFS, according to a 1997 study. In a 2002 study, researchers stated that impaired growth hormone secretion in terms of low IGF was found in about 30% of people with fibromyalgia, likely caused by a physiologic dysregulation of the hypothalamic pituitary adrenal axis, or HPA. There are a few patients with fibro who do have severe growth hormone deficiency, which is treatable. It was stated by the researcher Romana in a 2012 study after treating fibromyalgia patients 40 men and 180 women with human growth hormone. There was marked improvement in quality of life, energy level, and pain scores. The differences were statistically significant. It didn't work for everyone, but 85% of treated patients reported an improved quality of life, 10% no change, and 5% were worse due to either edema or an increase in muscle pain. Other medical conditions could have been the cause of the 15% who did not improve. In another 2012 study, researchers performed a randomized exercise experiment with 49 fibro patients. 26 patients did the moderate to high intensity Nordic walk, and 23 did the supervised low intensity walking program. Blood tests before and after the 15 weeks of aerobic exercise were completed. Changes in serum levels of free IGF-1 pain rating on a 0 to 100 millimeter scale, pain threshold, and a 6-minute walk test were examined, and inflammatory cytokines were determined. The baseline level of IGF-1 didn't change during high or low intensity of that aerobic walking exercise. Changes in IGF-1 correlated positively, however, with a variation in cerebrospinal fluid substance P, neuropeptide Y, and pain threshold. This data indicated a beneficial role of IGF-1 during exercise in fibromyalgia. In 2020, researchers investigated an oral amino acid supplement to increase growth hormone. Researchers stated that the use of growth hormone is controversial and amino acids are a potentially safer alternative. They made a novel blend of amino acids optimized to increase human growth hormone. They found that a single dose of oral amino acid supplement was sufficient to significantly increase human growth hormone in healthy adult men and women. At 120 minutes, human growth hormone levels increased by 682% or 8-fold. That's pretty awesome. Now let's fast forward to 2022. One study looked at the effects of an amino acid-based blend on human growth hormone and fibro symptoms, similar to the one in 2020. After 24 weeks, statistically significant improvements in blood pressure, A1C, LDL, and HDL, cholesterol, and triglycerides resulted. IGF-1 increased, body weight reduced, and improvements on the Fibromyalgia Impact Questionnaire Revised and the Perceived Stress Scale showed a substantial improvement. Now that sounds promising and is something I could get behind. An amino acid supplement that improved all of that. If I were to discover that I was within the 30% of patients with low IGF-1, more research is needed. So I guess in the meantime, I will continue eating well, taking my D3, and exercising, doing housework. So I'm feeling a bit sluggish today, not sure why. It's 44 degrees outside. Yesterday was the first day of spring, and I'm so excited for warmer weather. Yeah, I look forward to it. So I hope you learned something. I send you gentle hugs and support. Love you. But once this association between low vitamin D